Well, here to help us talk about this is UCLA neurosurgeon Dr. Neil Martin. Dr. Martin, welcome back to the show.
We brought in the big guns for this one.
Yeah.
And right as of now, over 20 teens, these are mostly girls, have been reported to have these symptoms. All cases have been reported in 2 towns in New York. And the symptoms are much of what we saw in that video piece. Tics, grunts, Tourette syndrome-like movements.
Right.
It's obviously shocking.
In a situation like this where there's so many cases clustered, the concern is obvious on the part of individual parents and the whole community. And the medical responsibility is first to deal with each patient individually and make sure they don't have some correctable medical condition that can stop the symptoms and get them back to their life. And then the next responsibility is the public health responsibility to make sure that there's not something in the environment causing this, that it's not an epidemic of some kind of unusual virus.
So let's go through some of the theories. Theory number 1 is that this could be an infection.
That's one of the possibilities. You know, people have heard of rheumatic fever, which is a strep-induced inflammation that can affect your heart and your joints, but this is like rheumatic fever for the brain, this concept. Now, there's definitely a very severe form called Sydenham's chorea, where people are wildly uncontrolled movements, and really is very, very dramatic and disabling. This may be a milder form of it called post-acute autoimmune neurologic disorder due to strep.
And let's go on to theory number 2 about environmental toxin exposure. One of the things in that piece that I found, quite honestly, a little laughable is environmental exposures have been ruled out. The reason you have to always be skeptical of that is there are so many environmental chemicals out there, we don't even know how to test for them. So to say that can be misleading.
And that train derailment caused 1 ton of cyanide to be spilled into the water table and 45,000 gallons of trichloroethylene. And apparently at the high school, parents had noticed an orange ooze coming out of one of the fields.
And they will continue to look at this theory of environmental exposure. And let's move on to another theory, which someone mentioned in the video, conversion disorder. That used to be called mass hysteria, where you'll display neurologic symptoms subconsciously without an obvious cause.
Yeah. Every one of us knows the power of suggestion. When you were in medical school and you learned about the symptoms of a brain tumor, half your class the next day thought they had a brain tumor. They all had headaches, they were dizzy. I mean, it happens to every one of us. The next week you got a different disease.
Now, the prevalence of this has been in girls. Is there any connection, do you think, there? And girls are very susceptible to conversion disorders as well.
Yeah, right.
I can tell you, having just taken a look at the literature, the medical literature on mass hysteria, which is very interesting to read, a lot of it sounds very much like this. It's 90% females who are involved. You know, there's a famous episode that occurred in North Carolina, and in fact, I talked to the doctor, Dr. Roach, who just reported. I just talked to him on the phone to get the follow-up on this. 10 cheerleaders in one high school all developed something almost identical to this back in 2002. And it was interesting. Their symptoms really only appeared when they were together with their friends. They generally appeared most often at lunch, not when they were in a classroom. And after everybody went off for their Christmas holiday and they were all separated and individually interacting in a different environment, the symptoms started fading out in most of the girls. And within a couple of months, the symptoms were gone in almost all of them.
And also, just so everyone knows, conversion disorder is a diagnosis of exclusion. There's no blood test, there's no imaging that can be done. So that's why you sequentially have to look at everything else.
Tics are not that unusual. Anywhere from 5 and some reports say up to 15% of adolescents, young kids, will have some kind of a tic during those years in development. And so if all the attention is focused on one group of patients who has the tics, then, you know, just by chance, somewhere else in the environment, some other people are going to have it, and then they're going to be worried they had the same thing, that they've caught the same problem somehow.